Michigan nurses are stretched pretty thin these days, even though we are beyond the height of the pandemic.
One lawmaker wants to ease some of that stress and lower nurse-to-patient ratios.
But as our Elle Myers shows us, the issue is complicated and that legislation is getting mixed reviews. She has a story tonight from the Capitol building in Lansing.
Michigan is no stranger to the shortage of nurses that's plaguing the country, and one state senator has aimed to fix it, but her legislation has been met with a mixed response.
Far too often what has happened in the past, especially we've seen prior to COVID and beyond, is that nurses have been overworked, and so they can't provide the quality of care necessary to help support those who are in need of care.
An additional goal, she tells me, is to lessen the load on Michigan nurses and maybe even entice some to come back to the profession.
Essentially, this bill would lower the patient to nurse ratios for several different crucial areas of healthcare in the hospitals. Right now, we have 50,000 nurses in the state of Michigan who are not currently working in the hospitals. Hopefully, with putting these ratios in place, it will help to bring some of those individuals back.
But Kim Meeker, who serves as president of the Michigan Organization of Nurse Leaders, says her organization and the Michigan Health and Hospital Association aren't in support of this bill.
Our stance is that we absolutely believe in safe staffing, but the tool that is being proposed on mandated ratios is not the right tool to correct the problem.
Meeker tells me the shortage of nurses in Michigan is a complicated issue, one that requires different ratios for urban and rural hospitals, even different ratios based on the type and intensity of care.
To distill the issue down to mandated legislated ratios really doesn't take into consideration the full complexity of nursing care and patient care.
Requiring more nurses per patient could have a financial impact on hospitals as well. But, Meeker tells me,
it's much less about the bottom line as it is about the unintended consequences to access to care.
Now, the Michigan Health and Hospital Association agreed, saying this legislation has the potential to severely harm hospitals and important access to patient care. For now, reporting in Lansing, I'm Elle Myers, CBS News, Detroit.